Assalamu alaikum students. Today our topic of discussion is pulmonary ventilation, and it is the start of a new unit on respiration. So it is the first chapter and the first topic, pulmonary ventilation. Goals of respiration to provide oxygen to the tissues and to remove carbon dioxide. And this can be achieved by four major respiratory functions. First is pulmonary ventilation, that is inflow and outflow of air between the atmosphere and the lung alveoli. And the second step is diffusion of oxygen and carbon dioxide between the alveoli and the blood, and then transport of oxygen and carbon dioxide in the blood and body tissues to and from the body's tissue cells. So, and the fourth step is regulation of ventilation and other phases of respiration. So these are the steps which are in sequence. The mechanics of ventilation, muscles that can cause a lung expansion and contraction. The lungs can be expanded and contracted in two ways: by downward and upward movement of the diaphragm to lengthen or shorten the chest cavity. In this, the vertical diameter increase or decrease, and by elevation and depression of ribs, increase and decrease the anterior-posterior diameter of the chest. So the ribs movement control the diameter that is anterior-posterior, and the movement of diaphragm controls the vertical diameter. During inspiration, diaphragm contraction pulls the lower surface of the lungs downward. Then during expiration, the diaphragm simply relaxes and the elastic recoil of the lung chest wall and abdominal structure compresses the lung and expels the air. So these structures move against the lungs, and so that the air in the lung is expelled. You can see here. During inspiration, the ribs protect almost directly forward, moving the sternum forward away from the spine, making the anterior-posterior thickness of the chest about 20% greater during a maximum inspiration than during expiration. So the anterior-posterior diameter is more during inspiration, that is 20% more. And during expiration, the ribs slant downward, allowing the sternum to fall backward towards the vertebral column. So the anterior-posterior diameter will decrease during expiration. You can see here anterior-posterior diameter and vertical diameter. Below is the diaphragm in dome-shaped pattern. During relaxed in the left diagram, when the diaphragm is relaxed, it is more dome-shaped, and there is a decrease in the vertical diameter of chest cavity. The muscles that elevate the chest cage are during inspiration are external intercostal, sternocleidomastoid, anterior stati, and scaleni. And the muscles that pull the rib cage downward during expiration are abdominal recti and internal intercostal. So these are the MCQ points. Pressure that causes the movement of air in and out. There are actually three pressures: pleural pressure, alveolar pressure, and then trans-pulmonary pressure. So we will discuss one by one. Pressure of the fluid in the thin space between the lung pleura and the chest wall pleura. So the fluid present between the chest wall and lung wall pleura, where there is a space called a pleural cavity, there is a fluid, and the pressure of that fluid is pleural pressure. Normally a slight suction, which means a slight negative. The normal pleural pressure at the beginning of the inspiration is about minus 5 centimeter of water, the amount of suction required to hold the lungs open to their resting level. The increasing negativity of pleural pressure from minus 5 to minus 7.5 during inspiration, and in the upper panel an increase in the lung volume of 0.5 liter, that is tidal volume. Then during expiration, the events are essentially reversed. So as the suction pressure is increased, that is increased from minus 5 to minus 7.5 during inspiration, so the lungs become expand, because this negative pressure is a suction pressure, so it allows the lungs to expand. And alveolar pressure, the pressure of the air inside the lung alveoli. When the glottis is open and no air is flowing into or out of the lungs, the pressure in all parts of the respiratory tree all the way to the alveoli are equal to atmospheric pressure, that is 0 centimeter of water. During normal inspiration, it decreases to about -1 centimeter of water, which pulls 0.5 liter of air into the lungs in the 2 seconds, and during expiration it rises to about +1 centimeter of water, which forces the 0.5 liter of inspired air out of the lungs during the 2 to 3 seconds of expiration. You will see these pressures in this diagram. You can see here firstly the pleural pressure. You can see here during inspiration it is a -7.5, while in expiration it is -5. And alveolar pressure during inspiration it is -1, and during expiration it is +1. So the transpulmonary pressure, the difference between the alveolar pressure and the pleural pressure. So the pressure difference between that in the alveoli and that on the outer surface of the lungs. So the transpulmonary pressure is the difference between alveolar pressure and pleural pressure. As you know, the alveolar pressure is the pressure inside the lungs and inside the alveoli, and pleural pressure is outside the lungs in the pleural cavity. So it is the difference between the two. It is a measure of elastic forces in the lungs that tend to collapse the lungs at each instant of respiration, called recoil pressure. So recoiling of lung is very important. So that the lung comes in a resting state. And compliance of the lungs, the extent to which the lungs will expand for each unit increase in transpulmonary pressure. So you have studied what is transpulmonary pressure. That is the difference between the alveolar pressure and the pleural pressure. So each unit increase in transpulmonary pressure, the extent to which the lung will expand is called compliance. And a total compliance of a normal adult human being is 200 ml of air per centimeter of water transpulmonary pressure. That is, every time the transpulmonary pressure increases 1 centimeter of water, the lung volume after 10 to 20 seconds will expand 200 ml. So when the transpulmonary pressure is increased by 1 centimeter of water, there is a total compliance of 200 ml, and it took about 10 to 20 seconds. So the characteristics of the compliance, these can be divided into two parts: elastic forces of the lung tissue itself and elastic forces caused by surface tension of the fluid that lines the inside walls of the alveoli and other lung air spaces. So firstly, the elastic forces of the lungs. The elastic forces of the lung tissue are determined mainly by elastin and collagen fibers interwoven among the lung parenchyma. So the lung parenchyma is made up of elastin and collagen fibers, and in a deflated lung, these fibers are in elastically contracted and kink state. So when the lungs are deflated, these fibers are contracted, and when the lungs expand, the fibers become stretched, therefore elongated and exerting even more elastic force. So during a deflation, these fibers are contracted, and during lung expansion, these fibers are elongated. And elastic forces caused by surface tension of the lungs. When the lungs are filled with air, there is an interface between the alveolar fluid and the air in the alveoli. So there should be an interface between air and the alveolar fluid. And that interface is made up of there is a fluid between the air and the alveolar fluid, that is a surfactant actually. The fluid air surface tension elastic forces of the lungs also increases tremendously when the substance called surfactant is not present in the alveolar fluid. So the surface tension of the elastic forces of lungs can be decreased by the presence of surfactant. But when surfactant is not present, the surface tension is more, and when the surface tension is more, the lungs become collapse. So for the distension of the lungs, there should be surfactant. You can see in the graph of pleural pressure and lung volume changes. Firstly, there is one part is expiration and the other part is inspiration, and you can see here that is the normal compliance, and that is when the saline is added, the compliance is reduced, and air filled. So the tissue elastic forces tending to cause collapse of the air filled lungs represents only about 1/3 of the total lung capacity, lung elasticity, whereas the fluid air surface tension fluid in the alveoli represents about 2/3. So fluid is more important, the concept of surface tension is more important than the elastic forces, than the tissue elasticity. So surfactant, surface tension, and collapse of the alveoli. Principle of surface tension: when water forms a surface with air, the water molecules on the surface of water have an especially strong attraction for one another. So as you know, there is a fluid and air, alveolar fluid and air. So the alveolar fluid has more attraction of one another. So the molecules of alveolar fluid have a more stronger attractions. As a result, the water surface is almost always attempting to contract. So there is the fluid in the alveoli also attempt to contract. This results in attempt to force the air out of the alveoli through the bronchi, and in doing so causing the alveoli to try to collapse. So when there is contraction among attraction among the molecules, so the lungs become collapse and air is pulled out of the lungs. Surfactant is a surface active agent in water, which means that it greatly reduces the surface tension of water, and so it doesn't allow the water to contract, or doesn't allow the molecules of water to attract each other, so make the air pull out and allow the lung to collapse. So surfactant avoid these actions. It is secreted by special surfactant secreting epithelial cells called type 2 alveolar epithelial cells. This is also MCQ, which constitute about 10% of the surface area of the alveoli. So it is produced by type 2 alveolar epithelial cells. These cells are granular, containing lipid inclusions that secreted surfactant into the alveoli. So it is a dipalmitoyl phosphatidylcholine is the surfactant, and it also constitutes apoprotein and calcium ions, and it is responsible for reducing the surface tension. So the pure water has a surface tension of 72 dynes per centimeter, and normal fluid lining the alveoli but without surfactant has a surface tension of 50 dynes per centimeter, but normal amount of surfactant 5 to 30 dynes per centimeter. So you can see that the surfactant reduces the surface tension of alveolar fluid. Effect of alveolar radius on the pressure caused by surface tension. It has an inversely relationship with the radius of the alveoli. So the smaller the alveolus, the greater the alveolar pressure caused by the surface tension. When the alveoli have half the normal radius, 50 instead of 100 micrometer, the pressure noted earlier are doubled. Okay, the pressure is equal to 2 into surface tension over alveolar radius. So the alveolar radius has an inverse relationship with the surface tension and with the alveolar pressure. Further surfactant does not normally begin to secrete it into the alveoli until between you can see here this is especially significant in small premature babies, many of whom have alveoli with a radius less than 1/4 that of an adult person. So premature infants have less than 1/4 of the radius of alveoli than that of the adult person. And further surfactant does not normally begin to be secreted into the alveoli until between the 6th and 7th month of gestation. Their lungs have an extremely tendency to collapse, sometimes as greater as 6 to 8 times that in a normal adult person. This causes the condition called respiratory distress syndrome of the new baby, a newborn. And it is fatal if not treated with the strong measures, especially properly applied continuous positive pressure breathing. Because you can see here that there is a more suction pressure is developed, and you know the suction pressure is negative, so we should provide continuous positive pressure breathing, so to neutralize the negative suction pressure. This is actually the, so you can see here that respiratory distress syndrome is due to the decreased radius as well as the decreased production of surfactant, and both of these factors ultimately decreases the surface tension and allow the lungs to collapse, which may cause the death of the newborn. Okay, so this is all about the mechanics of ventilation.